So the naloxone access is already been increased through pharmacies. So pharmacies are now dispensing naloxone. Our AIDS care organization, they are dispensing naloxone to their users, and all the addiction service providers, they are also getting access. So there is a process. The ministry has been rolling naloxone through public health unit, and we have been tasked to provide education to our community organization that fulfills the criteria. And then we will do the community education, we'll provide them with a naloxone kit, we will advertise them, we'll make sure that people who need naloxone, they have access to naloxone.
How do you enhance surveillance activities?
So right now we are already lagging data. So as mentioned, the number of opioid-related deaths, we have data from 2015, and then we recently got access to 2016 data. So there's always this catch-up game that we have to play. But in situations like these, which is continuously evolving, many more people are addicted to it, how can we build a surveillance system that would point out to us, what is currently happening in the emergency department? How can we get their data? How can we connect with the EMS data so that at least they can say they have received a call for an overdose or any other health issues related to opioid? How can we link it all together to develop some trigger mechanism for our community to say, yeah, this is a problem that has been happening right now in the community, and maybe we need to take some action, either working with our hospitals or maybe working with our care providers. So there are a lot of things that we can use to build a better surveillance system that would notify us for any early warning signs for opioid-related overdoses in our community.
So you mean surveillance of data, not surveillance with a camera or something?
No. It's a surveillance data. So when we talk about surveillance in public health, it is very specific to data and some mechanism to report back to the community. We're not talking about any other type of surveillance.
Thank you. It's a good question. It is, and both the warden and the mayor spoke about it. It is a frontline issue, and it is increasing every day, not only for EMS, but our law enforcement and our fire services that do medical calls and even fire calls. So it is impacting. It increases the call volume, and with that, it increases the budgetary impact. So how we address it and how we use these pillars and these tools to enhance, for example, the surveillance and the data. How do we connect the law enforcement data to the healthcare data so that we can understand if pharmacy robberies are going up and what they're going after, and how we can protect the pharmacies so that we can reduce the product. If you reduce the supply and the demand, then we can help. But we have to look at it as how do we treat and how do we support those that do have the addiction, because it's not that you can just cut it out. We have to support them so that they can get over the addiction and do it. To answer your question more specifically though, it does impact it with the call volume going up, not just